Hi everyone, Dr. Suneel, Dhand, medical doctor. Welcome to another video. I want to talk about what I believe is the great lie, enormous lie, behind how diabetes is treated across the world, specifically type 2 diabetes. And let me start off by saying that type 2 diabetes rates are absolutely soaring, unthinkable. It was once a very rare disease. Now it's one of the most commonly diagnosed diseases in adolescents and young adults in their 20s. I mean, what is going on? Remember, a lot of money is being made. The medical industrial complex is raking in the cash. In the United States, approximately $25 billion every year is spent on type 2 diabetes drugs. And that number is estimated to get to $50 billion within 10 years. And that's only drugs. When we factor in doctor visits, other complicated procedures, all of the complications from diabetes, I mean, the medical industrial complex is raking in the cash from people getting complications. And we've kind of normalized things, haven't we? That's what's happened. I mean, you look at the dreadful big pharma ads in the United States, it's seen as normal to get type 2 diabetes. It's absolutely not normal. What a ludicrous suggestion. Type 2 diabetes is almost always a lifestyle-related disease. And I want to explain to you the great lie that is at the heart of how medical establishments across the world really treat type 2 diabetes. And that is the notion that you can treat type 2 diabetes with medicines, which will magically lower the sugar levels down, and then everything is okay. People can continue on their diets. We'll give you this pill, or worse still, an injection, an insulin injection, and it will lower your blood sugar levels. So let me explain, and bear with me. I hope you can understand this explanation. So let's think about this. Type 2 diabetes usually occurs over many years of people, sadly, let's be honest and quite frank, neglecting their body. There's been weight gain. People have had a diet which is very high in processed foods, carbohydrates, sugars. I'm not saying everyone, but nearly everyone. And then the HbA1c, which is the most commonly used test in the Western world, starts to creep up, pre-diabetes, and then boom, type 2 diabetes. But the medical establishment kind of runs with this suggestion that, oh, we can just treat you with medicines. It's okay. Type 2 diabetes is very treatable. So let's think about this, because I want to explain to you how an elevated blood sugar that occurs is actually more like a symptom and a sign rather than the main problem. So whenever anybody has a suboptimal lifestyle, insulin resistance, which I've talked about many times before, and I'll include a link down below to a video I made explaining this, insulin resistance develops because people have a diet which is very high in carbs and sugars. They're not moving around enough, sadly. And slowly over time, people's insulin levels creep up. This is the insulin which is inside of us. Many people get confused and think insulin only applies to type 2 diabetics who are being treated. No, we all produce insulin from our pancreas whenever, in particular, we have meals which are higher in carbs and sugars. So the problem is that over time, people are consuming this horrible diet, this standard American diet, appropriate that it's named SAD, but it's the same across many Western countries, including the United Kingdom. So people consume this diet, which keeps on spiking their insulin levels unnaturally, way more than a couple of generations ago. And as a result, people become insulin resistant. Their cells become insulin resistant. And because they're insulin resistant, more insulin needs to be secreted to have the same effect. And the problem is that insulin is the fat storage hormone. It's also a hormone which is associated with inflammation. So people start to gain weight. And there are many tests that can be done even before the HbA1c goes up, including the HOMA-IR test, which relies on a fasting insulin level. I've talked about that many times before as well. If anybody wants to be diagnosed way before their HbA1c goes up, then get a fasting insulin level. So think about this. So insulin is high, and you kind of have this environment of inflammation, fat storage. So picture this, you have all this inflammation going on and fat storage has occurred. And then as a result of that, the blood sugar goes up. So imagine all of this inflammation going on here and the blood sugar goes up. And this is where the medical industrial complex whole paradigm is completely wrong. It's a big lie. Medications are administered to try to lower the blood sugar. Okay, forcefully lower the blood sugar. Do you see the problem though? All of that inflammation and insulin resistance is still happening over here. You've merely managed the blood sugar, so you brought it down, but you've done nothing to help with all of the insulin resistance, which is already there. And it is that which is causing people to have a lot of issues, all that inflammation. That's why type 2 diabetics, even if they're treated, often still get complications because we've done nothing to address all of that inflammation and cells which are under stress from too much insulin. And inevitably, people just get worse. But it is a complete lie, in my opinion, to have the notion that you can treat type 2 diabetes with medications. Because yes, you can fix the blood sugar, but, and here is the big but, you've done nothing for the root cause, for the upstream problem. Okay? So when you put forward this type of philosophy, millions, tens of millions, hundreds of millions of people simply think, oh, I can just take medicine. That's okay. That pharma ad on TV is just telling me to take this medicine and I can continue with my lifestyle. And this is why up until 50, 60 years ago, before the entire world and in particular medical establishment and medical profession went completely nuts, because type 2 diabetes was rare, very rare, a doctor would sit down with their patient and they would say, listen, what's going on? This is absolutely unacceptable. And you need to change your lifestyle, you need to lose weight, and you need to naturally reverse this thing because we can give you maybe rudimentary medications, but there's not this whole industry behind us. And the funny thing was, most people had to do that because there was no other choice. But now there is this false paradigm that, oh, we can pile on medicines to treat type 2 diabetes, but you can't do that. See what I'm saying? And think about this huge logical fallacy as well. I've talked about this as well previously. People with insulin resistance and type 2 diabetes have too much insulin in them. Okay? So we currently have the idea that if somebody doesn't respond to basic oral medicines and they have type 2 diabetes, then we give them insulin to lower their blood sugar. So you're forcing insulin in. And think about this. They've already got too much insulin in them. Their cells are crying out because there's too much insulin and they're resistant. And we're piling more insulin in. I mean, does that make any sense? It would be like treating an alcoholic with more alcohol. When would you ever do that? But yet this is the philosophy of modern medicine, that you can fix a number but not touch the upstream issue. Whereas 100 years ago, doctors knew you have basically, and this is what it is, extreme carbohydrate intolerance. You can almost think of it like an allergy. When would you give someone with an allergy more of that thing or say it's okay, you can keep doing it? Now, again, I'm not saying people need to go zero carb, but the only way to really fix type 2 diabetes is to, or even pre-diabetes, is to work on lifestyle. And I hear people saying right now, well, people don't want to do that. People won't do that. Well, yes, they won't do that because the medical establishment and medical profession is basically propagating the notion that you can have pre-diabetes or type 2 diabetes and we can treat your blood sugar and it will be okay. And they'll barely touch on the fact that people should modify their diet. Maybe there'll be a small line or two, but it isn't emphasized anywhere nearly as much as it should be. And this is why we are seeing the metabolic health disaster that we are seeing. And this is why it's not going to get any better at all, because the whole paradigm and the whole logic is faulty. You cannot treat a lifestyle issue with medications. It's not going to work. And until the medical establishment gets on board with this and says this whole medical industrial complex industry that has developed trying to treat type 2 diabetes, it's all basically a fraud. It's basically a fraud because they're trying to aggressively fix that number, which is just a sign of the inflammation and insulin resistance, but they're doing nothing about the insulin resistance itself. So, of course, all these people are still going to get sick, and that's exactly why we're seeing what we're seeing. And worse still, all of these people are going to put on more weight as well, because the more insulin keeps getting driven into them, then the worse it's going to be for fat storage. So we're kind of in this vicious circle, and the medical industrial complex can't even see it, or those who can see it maybe are staying silent about it, but it makes no sense whatsoever. So again, I hope you followed along with me, but at the very basic level, I hope you can follow along with the logic that if you have extreme carbohydrate intolerance, which is what type 2 diabetes is, then as long as you keep eating the carbs and sugars as millions do and think, oh, I can just take a pill or injection, and the only reason they think that is because that's what the medical establishment tells them, then we're going to keep seeing things get worse. Whereas 100 years ago, when type 2 diabetes was rare, doctors would be very honest and say, you need to change your lifestyle, buddy. You need to stop the carbs, you need to cut way back, and you need to exercise more. And that's how you reverse type 2 diabetes. So let me know your thoughts down below about what I've just said. I hope you could all follow along, but I believe that this is a complete and utter fraud at the heart of how we treat type 2 diabetes and how it is falsely propagated that you can manage type 2 diabetes with medications. Yes, you can fix a number, but that's about all you're going to do. The only way to treat it, and I would urge anybody out there, if you have a diagnosis of pre-diabetes or type 2 diabetes, you could be a whole new person within a few weeks, literally, if you take some steps and don't rely on the medical industrial complex to fix you. They are not going to fix you. They're going to make you a recurrent customer for life. You're going to get all of the complications and you will be quite miserable, both physically and mentally. Okay, everyone, do leave a comment down below. Check the links in the description down below for my website, all the other work I do, including my health program, the MetThrive Method, which does address how to reverse prediabetes, type 2 diabetes, and other insulin resistance-related diseases entirely naturally. Also in the links below, my free newsletter. If you're not already signed up for that, please do so. Our natural supplement store, ohighwellness.com if you're in the USA, North America, ohighwellness.co if you're in the UK, Europe. And if you enjoyed this video, you will also enjoy some of my other videos on how to maintain optimal metabolic health entirely naturally. We will speak again very soon.